Good afternoon. Thank you guys. Great to be here for one of our more recent test sites. I want to thank Senate President Bill Galvano for being here and for all he's done to support our efforts. Senator Gruters, and then we have Representatives Robinson, Gregory, and Representative Wengay Newton. Thank you guys for what you're doing. Thank you for coming here. Yesterday, the state of Florida reported the most number of test results since we've started this. We got 23,884 test results. Out of that massive batch, it only yielded 589 new Florida cases. And so if you look at the percent positive, which is something we track very closely, yesterday's test results have got to be the lowest percent positive since we've been doing any type of major testing. But it was about 2.61% of all the new tests that came in were positive. So that puts us at a 97+% negative rate. You look at other parts of the country, you have some places where there's still 30, 40, some are even close to 50% of all the tests are coming back positive. So here in Florida, we've seen that trend go down. I don't think we've been above low 6% in probably about 2 weeks. And I think that we've not reached 7 in probably quite some time. So I think that that's a good trend, but part of that is because we have worked so hard to expand testing. So this is here at the Sarasota University Town Center is the 12th state-supported drive-through testing site that we have throughout the state of Florida. As we go into phase 1, it's important that people, they're going to work, they have an opportunity to get testing. And I know people have done a great job, hospitals, doctors' offices. There have been a lot of great things done with testing, but we feel just having a baseline of state support in various regions of the state is very important. It's interesting, I wonder whether people will say as Florida launches into phase 1, percentage positive tests plunge to record low. I don't think they will write that headline because it's not going to generate the type of clicks, but the fact of the matter is Florida has met all the gating criteria to be into phase 1. Obviously, we're doing it very judiciously, putting the southeast Florida counties on a little bit different timetable, but certainly I think on the west coast of Florida we have the ability to move into phase 1 and then I think hopefully continue down the line. So this is important. We are earmarking 400 tests a day through here, but if there's more demand, we can do more. What we've noticed throughout the state is these test sites tend to have more capacity than there is demand. So you have different places that have similar populations to Sarasota, Manatee, maybe like a Duval County, and they're typically doing about 200 tests a day that go through those. This can accommodate 400, but if we need to scale it up, that will happen very quickly, and I know Jared has supplies ready to go. So far throughout the pandemic, just our drive-through sites have done 109,000 tests, the ones that the state has supported. There have been other drive-through sites that healthcare systems have set up, and of course they've done an awful lot as well. But this has been a real key component to us fighting the pandemic here in the state of Florida. Beyond the drive-through sites, we are continuing to pioneer walk-up testing locations. So this takes testing locations, particularly into underserved communities, and gives folks the opportunity to come get tested. Some folks, not everyone has a car. Not everyone has the ability to get to some of these test sites. So just those 10 walk-up sites, we've been doing these for probably about 3 weeks now, and we've done over 10,000 tests. Tomorrow, Director Moskowitz and I are going to announce the first of its kind mobile testing lab, where we're going to have an RV outfitted with a lab inside, and we're going to be doing the 45-minute rapid test. So we'll be able to take those to places such as long-term care facilities, test, and we are doing that now, but get results back immediately or close to immediately, which is very exciting. So we're going to unveil that tomorrow. The company that provides the rapid test said they're not aware of anyone in the United States doing the mobile lab like they're doing now. They actually do this because Cephia does the HIV test, so there's places in Africa where they will go around and do it. They haven't seen it yet, so the company's excited as well, and we're very excited to be able to announce that tomorrow. We have 50 teams of National Guardsmen that have been going proactively into our long-term care facilities to be able to try to identify clusters of infections with particularly asymptomatic staff. The very beginning of this, we had very stringent restrictions, didn't allow visitors into the long-term care facility, and had a lot of screening that had to be done for each staff member. The problem is you don't always show symptoms when you're infected. And so you can do the temperature check and all that. It's important and it does help, but it's not enough. And so we started to see cases in long-term care facilities where no one knew the staff member was sick, and it would spread like wildfire amongst the staff. So they've gone in proactively and they've identified some clusters and have isolated those and prevented many more infections, which is very, very important. We also are going to have more convenient testing with some of the private businesses. Walgreens is setting up 9 drive-through sites throughout Florida. There's going to be one in Hillsborough County, but they may end up doing more. CVS is going to do some. Walmart is going to open up drive-through sites in partnership with Quest Diagnostics. And so if you think back to February, there were not even really tests available. The CDC was the only one that had them. And really the criteria was you had to have certain symptoms, you had to be a certain age, and you had to have some connection with travel to China. Well, that is a much different picture now. You want to come to this test site, obviously if you have coronavirus symptoms, come. It doesn't matter how old. 2, if you're a healthcare worker, first responder, regardless of symptoms, come get tested. And then even if you're somebody that's totally asymptomatic but believe that you may have been exposed to coronavirus in one way or another, come. We want to definitely, I think if you look at the numbers in Sarasota, Manatee, there's not been as many younger people that have tested than in some other parts of the state. So this gives an opportunity for folks that either have symptoms, work in healthcare, or may just think that they were in contact with someone. So we think that that's a good thing. We're also going to be announcing this week the deployment of antibody tests at our drive-through testing facilities. So the antibody tests whether your body has developed antibodies, which means that you have had the disease in the past. And because so many of the cases we're starting to learn, or we've actually probably figured this for many weeks, the vast majority of cases appear to be either asymptomatic or the symptoms seem to be so minor that you wouldn't even necessarily think to go get medical attention. You look at some of the antibody academic test research projects that have been done at Stanford, in Santa Clara County, Miami-Dade, University of Miami did one, LA County, New York City and state have done them. What they're finding is the number of documented cases is one thing. The number of people with the antibodies is far, far in excess of the number of people who've actually tested positive with a diagnostic test. So that's important to know. If you're a healthcare worker and you have the antibodies, then obviously you have immunity. We don't know how long that immunity is. Some people think 6 months, 2 years. I think eventually we'll find out. But certainly that's important. If you work in a long-term care facility and you have antibodies, that's important to know. And then also just people, I've had people say, I had a really nasty illness in late February. I went in, tested for flu, was negative. I may have had this. Well, you come in, if you have the antibodies, then you'll know. Usually the antibodies take about 2 weeks to develop. It's not something that would happen overnight. So certainly if you were infected anytime February, March, early April, we would expect the antibodies to show. So we have already received 200,000 antibody tests for serological testing. We've done a survey of all the hospitals that may need some, so we're going to send them to any hospital that wants it. Clearly, it's important for the doctors and the nurses, so we're going to do that. And then we're going to have lanes dedicated to antibody testing at our drive-through sites, and so people will be able to come by and get through that. We're also going to likely do our own state of Florida study where we can try to determine the prevalence in different parts of the state. As you look at the numbers, we have almost 40% of the cases are in one county, Miami-Dade County. And then if you look at Southeast Florida, they comprise 60% of the cases and similar percentages for hospitalizations and fatalities. So the prevalence there may be a little bit different than some other parts of the state, but it's important for us to know. So antibody testing is finally here from the state. We're going to get many more coming down the line, but this 200,000 I think will be a really good start. It's also important to look and understand who is the most at risk from the coronavirus. In the state of Florida, those who are 85 and older represent 5% of the documented positive cases in the state of Florida, but 30% of the fatalities in the state of Florida. People that are between 75 and 84 represent 8% of the positive test results in the state of Florida, but 30% of the fatalities. So you're looking at 60% of the fatalities in the state of Florida are folks who are 75 and up. Most of those folks had one or more comorbidity. And so we understand who the most vulnerable groups are to the coronavirus. We also understand the people, if you're 50 and under with no conditions, you're at low risk, and that's a good thing to know. But it does require us to continue to do all that we've done and really make it even stronger for supporting our long-term care facilities. We did a lot at the very beginning. CMS used Florida's model as its guidance that it pushed out to the other states. Jared has been great. One of the things we knew was we needed the folks in the long-term care facilities to wear the PPE, mask, and other things to help cut down on infection. But we had to put our money where our mouth is. So Jared, pretty soon, at Department of Emergency Management, we will have sent out 10 million masks to just long-term care facilities. I think where Jared has the exact numbers, but we've sent out 8 million for sure, and we have many more on the way. We've also done over 1 million gloves, 500,000 face shields. When I presented that at the White House and showed what we've done, FEMA has now responded by doing something similar where they're sending PPE directly to the long-term care facility. So Florida long-term care facilities are going to get what the state sent. They're also going to get things that FEMA is sending. So that's going to be a pretty important stockpile to be able to have. But we also understood that you needed to have the expeditionary testing. So you have that with the National Guard. RRV mobile testing lab will be focused on this most vulnerable group in our society. And so we think that that's going to be a major force multiplier. But we also, and Florida hospitals have worked very well with our ACA agency, Secretary Mary Mayhew, as well as the Florida Department of Health, on not sending COVID-positive patients back into nursing homes that can't accept them. Other states, that was their policy. That has not been a good standard of practice. And so what you've seen, places like the Cleveland Clinic, I was at Halifax and Daytona, they understand the risk that comes with that. So what they're doing, I think pretty common practice in Florida has been if somebody comes in and they're COVID positive, you don't send them back to the nursing home until they've had 2 negative tests. But we also understand that there could be people that go in from nursing homes to seek medical attention who not for COVID, but you don't know whether they have it or maybe they develop it. So even if you're not having COVID, we are now requiring a negative test to be discharged and sent back to the nursing home. As part of my order into phase 1, where we turned on the elective procedures, we wanted hospitals, what they have to do is assure us that there's going to be hospital space in the event of a COVID hospitalization spike, that they have adequate PPE, and then the third most, I think, important factor is, and most of this is just a continuation of current practice, but working with both the state and the localities on making sure that the long-term care facilities and nursing homes have adequate support. So we are actually doing an actual emergency rule that was issued yesterday. Any individual discharged to a long-term care facility does need a test, a negative test, regardless of symptoms, regardless of whether they even went in for COVID-19. And I think that will help, because you send an asymptomatic senior back, that can really spread inside one of those long-term care facilities. We're also formalizing some of the transfer guidance that ACA has been giving throughout the course of the pandemic. Basically, we are requiring long-term care facilities to transfer residents that test positive for COVID-19 if the facility is not properly equipped to isolate and care for the patients. We do have some facilities that have isolation, negative pressure rooms, where you could care for a COVID patient. Many of them do not have that, and so if they do not have that, you don't have a way to keep this from spreading, and so we need them to be transferred to a safe environment. And I think that that's really, really helpful. County health departments will be assisting the facilities with the implementation of the transfer directive. Again, a lot of folks, this is kind of how the practice has been going. We think it's important to formalize it. We're not trying to be punitive. We just want to make sure that that we're not doing anything that would exacerbate the problems that we already have. The reality, though, is that many of these CDC infection control standards exceed typical expectations with these facilities, especially related to isolation. So that's just the reality, and we want to make sure that we're doing the best we can. We also, though, understand that we need to incentivize hospitals to want to continue doing this. If you look, you actually get, if you keep them in a long-term care facility, you can potentially get more money from the long-term care facility from Medicare, and we think that that's problematic. So I wrote to Seema Verma requesting that CMS provide hospitals reimbursement for patients with COVID-19 that may not otherwise meet hospital admitting criteria. It's flexibility that we're looking for on the reimbursement. Will make it easier for hospitals to take transfers from nursing homes and assisted living facilities to keep patients that are COVID positive from having to return to a nursing home or assisted living facility. We think that's where the administration is going on this because I think they understand that this makes it safe for the other residents. And right now, the hospitals, throughout this whole pandemic, we've had 45% of all beds have been empty in the state of Florida. You'll start to see that change because we have the elective surgeries turned on, so people are going to start going in. You will have inpatient surgeries. I think also people were really scared about going into the hospital for other ailments. We've tried to stress, focus on the facts, don't focus on fear. Hospitals are safe. You have chest pain, stroke symptoms. Do not just wait that out because that can really exacerbate your situation. And so we think people are doing that. I think you're starting to see more people seeking medical care, but certainly we want to do that. So I think that is going to be a great step forward if CMS is able to go in this direction. It aligns the incentives with safety, and at the end of the day, that's what we're looking for. We're also trying to protect those suffering from mental health and substance abuse. Now, these populations are not discussed as frequently as the elderly and individuals with underlying conditions, understandably so. Individuals with mental health and substance abuse issues do have increased stress, pressure, and anxiety caused by this emergency, particularly with the mitigation measures.